Welcome to this session of the PlantPure Summit 2016, co-sponsored by PlantPureFoods.com. Our guest is Henry Guzman. Henry is currently the Director of Wellness Strategies at Baptist Health South Florida. He's been actively involved in the area of wellness and prevention for 20 years, working as a health and wellness educator and manager of employee health. Presently, his focus is on developing and implementing lifestyle modification programs for Baptist Health South Florida's 16,000 plus employees. So welcome to the summit, Henry.
Thank you, Lee. I'm really excited to be here. I'm actually a big fan of your work. I'll share a little bit about how I introduced forks over knives to some of our employees, which kind of got us on this plant-based way of thinking. So looking forward to it. Okay,
cool. So when and why did you first become interested in the field of health and wellness?
Let's see, I guess back in undergraduate school was my first kind of interest in health and wellness. So my third year of school, I wanted to get into something that had to do with wellness prevention. I wasn't quite sure what I wanted to do. I don't know if I'm much different than the rest of the population at that age. But one particular experience that stands out was I have a family member who suffers from severe depression. And I had done a little research on depression. And there were some studies suggesting that nutrition and exercise had a positive effect on depression. That kind of piqued my interest a bit. So I wanted to learn a little bit more about it. So my undergraduate studies, I got involved in exercise, sports medicine, exercise science. And learned a little bit about how nutrition, exercise, etc., affects the body at a cellular level. Wasn't quite sure. I saw the whole picture at the time. Very clinical. And after undergraduate, one of my first jobs was at a place called Pritikin. I don't know if anybody's heard of the Pritikin Longevity Center. But that really opened up my eyes to the possibilities of what plant-based nutrition, along with physical activity, can do for somebody's health. My experience there was very, very interesting. Back then, I think they were a little ahead of their time back then. We're going back, wow, I hate to admit this, but probably over 20 years ago. And they had this very robust lifestyle modification program. And one of the main components was, of course, food. So at that time, the people who participated in the program actually lived with us. It was an old hotel on the beach, and you checked yourself in for a minimum of a week. And we fed you, we exercised you, we gave you a lot of lectures on whatever particular issues you were interested in. And after just 1 week, I saw amazing results, and not just very objective results. This wasn't just me seeing somebody look happier or look better. Before these folks actually got started in the program, they did stress tests, blood work, and we did it before they left. So objectively speaking, we saw cholesterol levels drop 20, 40, 50 points, depending on how engaged that person was. Of course, there was weight loss, and I was just blown away. And I think one of the main components, of course, was the food, the nutrition that was being offered. And it was basically plant-based. I didn't know it at the time. It didn't really hit me at the time. When I look back on it, the amount of protein that was served was maybe an ounce once a day. The rest was legumes, vegetables, available to you all day long, as much as you wanted. And that's really kind of was my, I guess, my launching pad, if you will, for plant-based nutrition and how it affects, how the potential to affect your health.
So is plant-based, I take it plant-based nutrition now is part of the programs that you develop? Absolutely.
That's one of the key components. So it's a great question. And maybe I'm jumping the gun a little bit here, but getting folks to adapt this lifestyle is challenging. It's one of the challenges that we've encountered in all the programs that we've tried to get going here at Baptist. But you know, I'd like to share some of those experiences with you. But yeah, absolutely, it's one of the main components for all our programs that we put together here.
When did you decide to incorporate plant-based nutrition into your programs? Was that something that you did from the very beginning, or did you sort of work it in as time went on?
Well, we knew when we started our first lifestyle modification program, if you will, that we offered to employees, that we needed a lot of different components if we wanted to kind of address the person holistically, if you will. So we knew there had to be exercise. We knew they had to eat better. We knew we had to figure out a way to get them to help reduce stress if that was an issue, and when is it not an issue for somebody. So at the time, we worked with some nutritionists. We're going back about now 10, 15 years or so. And we encourage basically, you know, low-fat, lean meats. Always advocated for vegetables, but again, it wasn't the focus so much. We didn't push it as much, just to make sure, you know, low salt, low sugar, low fats. That was kind of the main gist. And we did see a lot of improvements, but that was kind of how we started.
So when or did you run across the work of like Dr. Esselstyn and Dr. Campbell? Did you read their books and stuff? And how much of an influence did that have on you?
A huge influence. One of my colleagues introduced Dr. Campbell's book, The China Study. And I read that, and I was just blown away by the information that he shared with us during his studies there. It was irrefutable evidence of how certain foods affect the body, especially meats. So that was just amazing. And then, of course, there were documentaries out there. The big one being, of course, Forks Over Knives, and all the studies coming out at the time. And that's kind of, yeah, absolutely. Those were huge influences in how we started our program and how we continue to develop our programs.
So how effective is plant-based nutrition among the people who adopt it in your programs?
The ones who follow it to a T, we're just blown away. One of the programs that we offer it at 3 to 4 month intervals. They're very intensive 12-week programs. And we found that the folks that followed them more closely, they all did well in the end, but the ones that really stuck to what we recommended, the whole food, plant-based, the exercise sessions, the stress reduction sessions. We've had folks drop, we had one woman, several folks drop cholesterol levels over 100 points, which we had to retest just to be sure these numbers were correct. Blood pressure's coming down. We work with medical staff here, so we do blood work, etc. We had to reduce blood pressure medications because once they got on that exercise routine along with the diet, their blood pressures would drop so low. We had to go back and reduce their blood pressure medications. A1C levels, the blood sugars dropped dramatically over the course of the 12 weeks. So as far as the effects, they're I almost venture to say they're almost immediate. Within a week, you could see these things happening. So just the amount of empirical evidence that's there, it's just amazing. It's amazing.
So what, among your patients, among the people in your programs, what's your compliance rate with people following or falling off the wagon and so forth?
That's a great question. So when we first started, we had a little pilot with about 10 folks in it. And we gradually grew it to about being able to take about 100 people at a time. So our staff grew, our resources grew a little bit. And we also made the program a year long instead of just 12 weeks. Because what we saw what was happening is after those first 12 weeks, people were going kind of back to their old habits. So we decided to make it a year long. The first 12 weeks were still the most intensive. So during those first 12 weeks, you're actually meeting with an exercise physiologist 3 times a week. You're meeting with a nutritionist just about once a week. We started using a little bit of technology at the time, accelerometers like Fitbit, and apps like MyFitnessPal, where you can log your food. So we actually had nutritionists checking your logs and exercise physiologists checking your steps throughout the day. So those first 12 weeks that you're monitored, compliance rate was about 95%. So amazing results. Just to share with you, after those first 12 weeks, we do get everybody together and have a little celebration and ask if anyone wants to say a few words as part of their experience during these first 12 weeks. And some of the stories that we were getting back were just so emotional and inspiring that we decided to start filming some of this stuff. So we got a little pocket camera and started filming some of these celebrations over the years. And we have some very poignant stories that came out of there. And everything from what an amazing service that we're offering them to you literally saved my life. We actually have a little video we put together. Not sure if it's available outside of the system. If it is, we'll try to post it so you can get an idea of what I'm talking about. So we knew we were doing something pretty cool here. And through word of mouth, it got to the point where the senior executives were seeing some of these results and started to get involved themselves. So over the years, we've had staff members, physicians at the executive level, and they're all just blown away from what they've seen. This has trickled down also to their family members, to coworkers, kind of getting on board. So it's been a fascinating ride.
So when you first start people off on the program, do you get a lot of resistance from people at first about switching to a plant-based diet, or are people fairly open to the idea of it?
That is a great question. So it's probably one of our biggest challenges. I think in general, if you come out of the gate trying to convince people to switch to a plant-based diet, you're going to get a lot of resistance. I'll share a story with you. The system, Baptist Health System, has been trying over the years to offer better for you products in our cafeterias or vending machines, really making that slow evolution towards healthier eating with our employees and patients that come through. So obviously it's not something we could just get rid of all the bad stuff. They started off by getting rid of all fried foods, which is a great start. Looking at saturated fats, getting rid of those foods, especially the trans fats, which was really popular back then, getting rid of those, so the evils of trans fats. So our plan was to introduce the program as this lifestyle modification program. we can help you achieve your health and fitness goals. So these are the components that you're going to be exposed to, you know, different ways of eating, exercise, stress. So we never really said plant-based. So when you got together with your nutritionist, the nutritionist would tell you about how food affects your health, how it affects your lipid levels, your blood sugars. Staying away from that conversation of, you know, you have to eat vegetables. So at one point we got together with a lot of the executives, starting with our CEO, who's one of our biggest champions of health and wellness and making these changes, trying to figure out how to implement these changes in our cafeterias. So an interesting conversation took place. You know, people are very sensitive about food. At some point during this conversation, someone said, "Does this mean you're going to take away our bacon?" Oh boy, that opened the door to all kinds of interesting dialogue about what foods we're going to take away from you and that you're not allowed to eat, which really strayed from what the conversation was really supposed to be about. So when you start to talk about specific foods, you start to lose folks. If you tell them you can't eat bacon, you can't eat ham, you can't eat, etc. So we tried to stay away from the specifics in the beginning. So we basically tell them, look, it's important that you increase the amount of produce in your diet. So to help you with that, we're going to give you a bag of groceries once a week, along with recipes. So part of your homework is to try this recipe and give us some feedback. Let us know what you think. As far as the protein goes, you know, you can go ahead and have your little piece of, you know, lean protein. But remember, the main part is try to incorporate those vegetables. Try new vegetables that you haven't seen before. So we would deliberately buy vegetables, you know, whatever was in season at the time. It's amazing how little folks here, anyway, in this part of our country, know about different types of vegetables that are available to them. So it almost seemed exotic to them when we would throw in, you know, different color peppers. You know, it's not just green. There's red. There's, you know, yellow. Different types of lettuces. So they were kind of intrigued by this. Of course, they're getting it for free as well. So after the first couple of weeks, we would do some quick little blood tests, little finger sticks, and blood pressure checks and weight checks. And they would notice that their blood pressure was getting better, that their numbers were dropping a bit. But more importantly, they were feeling better. They were telling us, look, seem to be sleeping a lot better at night. I'm not as tired when I get home. So somewhere between weeks 6 and 10, we decided that this might be a good time to introduce more in-depth information about plant-based nutrition. And this is where we actually introduced forks over knives. We encouraged our participants to watch this video. If they didn't have it, we had a little library set up with videos that we had purchased. And that was part of their homework assignment. Well, now that they understood kind of firsthand the effects of what these foods can have on your body almost immediately, and then after watching this documentary, they were much more ready to go a little bit further with it. So that's sort of how we introduced the plant-based approach.
So you sort of draw them into it slowly, you know?
Yes, absolutely, absolutely.
That's smart. I'm glad the movie doesn't scare them off, you know what I mean?
No. It was very eye-opening. We don't introduce it in the beginning because I think it would scare them off the bat. But once they have a little information and have gone through some of it already themselves, they're much more open to try new things and to stick with it a little more.
Very cool. So how have you personally benefited from a plant-based diet?
Well, once I started making those changes, you know, I saw my cholesterol drop. Biometrically, I saw I saw a lot of changes that I thought were okay. I'll share my blood pressure at the time wasn't so bad, what you would consider bad. It was in the high 120s, maybe 130s over high 80s. And just to kind of, in case, kind of give you some guidance there. Ideally, blood pressure, they've changed it a little bit, but 120 over 80 was kind of the standard. Now it's a little bit lower than that. And my blood pressure now is in the low 100s, low 70s, 60s. I do exercise also, but I think the switching more towards plant-based has really attributed to that. My cholesterol now is in the 130s. It used to be in the 190s. And my triglycerides probably dropped 20, 30 points over the years, and it's stayed consistently. Energy levels, just in general, how I feel. Whenever I do kind of slip and eat something, that's not so great, don't feel so great afterwards. I don't sleep so well that night. So it makes it a lot easier to stick with it.
Very cool. So what do you think are some of the biggest problems with our healthcare system today?
Oh, wow. We have such an antiquated healthcare system. It's amazing it hasn't changed over the last 50 years or so. We're basically still treating symptoms, which just blows my mind. We don't get to the root of the problem or even have anything in place to address the root of the problem. So the problem, well, 70 to 80% of most of the chronic illnesses we see are due to lifestyle behaviors. But we've done nothing to really address those things, other than, a little lip service. I'll give you an example. You go to traditional primary care, and they'll do some blood work, and maybe you'll get an earful about, losing weight or eating better. But, what does that really mean to the average person? You're going to leave that office and not change one thing. So what are we really offering patients when they come with an issue, other than some medication? Not much. If you're lucky, you get 10, 15 minutes with your physician. And if you're extra lucky, he's well-versed in nutrition and exercise, and can give you at least a few tips or some recommendations. I think that's probably the roots of the biggest problem in our healthcare system. So, of course, if you don't address those things off the bat, whether it's obesity, cholesterol, high blood pressure, diabetes, those things obviously go on to create worse health issues. At some point, there's going to be a financial breaking point, either for organizations or for individuals. I mean, how much can you afford to pay for health insurance? We subsidize over $100 million for insurance, and it goes up every year. And the organization subsidizes almost 85 to 90%, and we still, as employees, still have to pay a substantial amount monthly. So at what point, at what point is the consumer or is the business going to say, you know what, we just can't afford to keep doing things the same way? What can we do differently? So I think that's probably the biggest challenge in healthcare. And I think one of the reasons that nobody's taken that plunge yet is it's a big black hole. What do you do? How do you start? How do you really get someone to change their behavior? That's really what we're talking about. I think as far as what to eat, I think that debate's been kind of settled a long time ago. I mean, we still get conflicting information, but the reality is that the closer you stay to a whole food plant-based diet, the better off you're going to be health-wise and probably every other aspect of well-being. There's still a lot of conflicting and confusing information put out there by businesses, and I think that's done purposely. You get one study that says whole food plant-based diet, helps with cholesterol, helps with losing weight, etc. And then you'll see another study that says, eat all the meat and eggs you want and you'll lose weight. By the time that study gets vetted by folks who know what they're talking about, you're in a state of confusion. That might take months for someone to read that and say, there's a lot of holes here. What you're saying isn't really accurate. But by the time that information gets out, you're in a state of confusion as an average consumer. So what do you think? What are you thinking? You're just, they say meat's bad. This study says it's good. Some studies say I should eat more vegetables. Some studies say it doesn't really matter. I'll eat whatever I want. Something will kill me in the end. So very, very confusing, and understandably, it's hard to get this information out there when there's so much money in advertising being pumped out on a daily basis from everything from TV ads, magazines, newspapers, advertising's everywhere, and conflicting information. So how do you fight that? One person at a time, I guess, or exactly what we're doing here. Trying to get this message out, trying to get factual information out so there's no confusion. So at least you give the person an opportunity to make a choice so they're not confused. So our kind of way of thinking or philosophy is, let's at least provide factual, correct information and let you decide what to do with it. So, but I don't think folks have that option right now. There's just too much confusion.
So would you say the key to reforming our health system is moving more towards prevention and wellness and those sorts of things, as opposed to, as you say, just treating a symptom or treating a problem when it's already come up?
Absolutely. And that conversation's come up. If you see there are some health systems that are trying to put some sort of wellness and prevention in place, even at the primary care level. But there's really no practical components to it yet. There are some systems that are actually creating these medical fitness centers where they've actually combined a gym-like atmosphere along with a clinical setting. So the idea behind that is not only is it just a place where you can go learn about fitness and nutrition, but if you are a patient, you can be referred to right in-house to an exercise physiologist or nutritionist to help you address those issues that are causing, the diabetes or the weights or the blood pressure, etc. So it makes it easier for the consumer having everything under one roof, as opposed to a physician telling you, here's a prescription to go, next week to go see a nutritionist. You may or may not go, and that one visit, if you do go, not sure how much is going to stick with you by that one visit.
Do you think we're moving in the right direction in terms of reforming our healthcare system, or do you see it just not happening right now?
It's encouraging to see that conversation is taking place, that at the executive level. I can tell you here at Baptist, we have task force committees, health population committees, weight management committees that are looking at new ways of addressing wellness and prevention, and how to bring it not just to our employees, but to our patients and consumers. So that's very, very encouraging. I think we're very close to getting the resources that are needed to actually put some of this stuff in place and integrate it with our healthcare system, whether it's within the primary care or within the hospital setting.
So tell us about some of your athletic activities. I think they're pretty impressive.
Well, they've gotten a lot less over the years. that was sort of a way for me to kind of motivate myself to, to keep moving. So I started running a little bit. Man, I hated running. I don't know who invented running, but I can honestly say that I hated it. But I thought, let me just try. Let me give this a try. And every day I'd run a little further. That slowly morphed into running my first mile, and feeling so accomplished running a mile. And slowly over the years, some coworkers who were big runners said, why don't you, join a race, a 5K or something? And I thought, why not? So I got a taste of my first 5K, and that energy and that atmosphere kind of got you motivated, which was really nice. So, I eventually ran my first marathon, and I started getting into triathlons and swimming, biking, that sort of thing. It was fun. I don't compete so much anymore. I have my routine of biking with friends and running with buddies and trying to get folks motivated within my department to come out with me and just be active. So
tell us about some of the publications that you've had in journals and things like that.
Yeah. We were fortunate enough about 4 or 5 years ago to have the system hired a very well-known researcher. His name is Dr. Karim Nasir. And he heard about all the programs we were doing, and he asked us if we were collecting data. We said, "Oh yeah, we collect everything." We had no idea what to do with the data, or what we were going to do with the data. And after we showed him what we had, he said, "Do you have any idea how much information you have here?" So he helped us kind of sort out that data and put some stuff together. And along the way, we've published stuff in everything from the American College of Cardiology, American Diabetes Association, and we probably have 20 plus articles and abstracts and papers along the way, showing some of the results that we have with the programs that we've put together here. So we've been fortunate enough to go and present some of this stuff at the ACC and ADA, and bring our little poster, and it's been really nice.
That's cool. So what about some of the other research projects that you're collaborating with?
Yeah, so we're trying to put together a pilot program in our cafeterias, offer plant-based, whole food plant-based meals to maybe 50 employees. Offer them either breakfast and lunch, or lunch and dinner, and just track them for similar to what Nelson Campbell did in his documentary, the one we produced with him as well, Plant Nation, to kind of document the same type of results, but at the same time gather enough data, just like he's doing, to present a stronger case, not just within the system, but to our community as well. So it's not just us saying that we think this is the best way to go. We have research, we have data. I think that sinks in with folks a little bit more. They pay a lot more attention, and it buys you a lot of credibility.
So what do you see as the future of healthcare in America?
How do I picture the future I envision? I think ideally we would use a lot of other healthcare professionals, not just physicians. So ancillary healthcare professionals like dietitians, exercise physiologists, health coaches, and use them more in an integrative way within our healthcare system, so that we have some sort of practical component to the way we deliver healthcare. So if a patient comes in with high blood pressure or any other chronic condition, The physician can, evaluate him, do lab work, etc. But now we have something to actually show this person what to do next. Maybe it's something simple as a cooking demo and a taste test, so they see that this type of eating isn't, miserable, and it's not yucky. It's actually delicious, and at the same time, it's really good for you. So that practical piece, I think, needs to be incorporated at all levels of healthcare. So,
do you see that happening now? I mean, is it happening more and more? I mean,
yes, absolutely. Even within our system, where we have health coaches embedded in our primary care to kind of start that conversation. So that's very exciting. We're hoping to take it to the next level. I think a big challenge for most places, including us, is that, in the end, you got to think of the finances as well. Can we get reimbursed for this, for these services? We can offer the sun and the stars, but in the end, who's paying for it? So the more research we do, the more data we gather, and we can show insurance companies that, if you invest a little bit in this, you're going to save a whole lot more in the long run, paying for whatever health issues happen for these folks down the line.
So do you think plant-based nutrition is an idea that's come to stay?
Absolutely. And this is a great forum that's going to keep this conversation going. Again, the more information that's available, the more data we collect, the stronger our case will be. Not just with our, customers, employees, and patients, but within the folks who create our laws. If we can have some effect on that would carry us a long way. As long as there's so much conflicting information about nutrition out there, it's going to be very challenging to get folks to pay attention to what we're talking about, and to get people to change their behavior, their eating behavior.
What's it like developing programs for such a huge employee base, 16,000 people? I mean, that's a lot of employees. How do you approach that versus working with a smaller group?
That's a good question. So obviously, some of the more intense programs, we can only take a certain number of folks, anywhere between 50 and 100 at a time, and we're targeting the folks that already have active disease. So of course, there's a whole nother population of folks who are kind of on the borderline, or other folks who we're trying not to get that far. So we do have exercise physiologists and health coaches that do a lot of promoting throughout the system. And the hope is that those folks that aren't ready to make that big commitment to change, we'll at least plant a seed in there along the way. That's really our approach. At the level of employees that don't really have any active disease going on, they feel fine, etc. It's a lot harder to get them than the folks who are already sick, obviously. So we do a lot of fun activities. We do walking challenges. We're putting one together now where we're trying to see if we can get enough people to participate throughout the system, where we can walk from Earth to the moon, things like that. And then from there beyond. So I think those are fun activities that at least will start to get folks engaged, and then slowly introduce other topics as far as stress and eating, trying to eat a little bit more plant-based, whole foods, flyers, table tents. We have digital signage with messages. We've created video libraries for anybody who's interested in information on nutrition or exercise. But it is challenging to get this message out to so many people. But through word of mouth, we've probably if I had to take a rough guesstimate, probably 85% of our employee population knows about most of the activities that we offer throughout the system.
That's a great number. And the work that you're doing is great. So I want to thank you for that. And thank you for taking the time to be at the summit. Is there a website where people can go and learn more about what you do?
Absolutely. If you go to BaptistHealthSouthFlorida.net, you can see everything that's being offered at the system and also at the wellness level. There should be an icon there that says Wellness Advantage, and you can read more about all the cool stuff we're doing.
Very cool. So I want to thank everybody else for watching. And if you want to find out more about what we're doing to create a plant-based world, a PlantPure world, visit us on our website at plantpurenation.com. So thanks again, Henry.
Thank you.